Welcome back as we are talking Ramadan. Today is the second day of the holy month and everybody is happily receiving this holy month every year. But of course, the question that would cross everybody's mind whenever Ramadan knocks on the doors, it's how are we going to manage our daily routine, the daily diet, and how are we going to manage iftar and suhoor? What are we going to eat? Are we going to spoil our diet? These are lots of questions that we should definitely try to find some answers, because some people are, have chronic disease, some people are on diet, some people are lots of situations that we should follow a very strict diet in order not to spoil our daily routine. And this is what we are going to talk now with one very good expert who's here live with us in the studio, Dr. Munir William. He's a professor of plastic surgery and a nutrition consultant at the same time. Good morning, doctor.
Good morning, sir. Of course, now, I mean, in Ramadan, everyone is really hungry during the day, and especially now we're in the summer, and we're hungry and thirsty, and we don't eat until 7, so we have a very short time where we can actually eat. But if we can talk about health-wise and actually kind of maintaining and tracking what we eat and how we start eating, can you tell us about that, and kind of watching what we eat and not eating too fast, all the advices that we should start out with?
Yes, of course, during the holy months of Ramadan, it's very important to use this long time of fasting in order to perform diet control. And also, this can be done through our meeting, our professor, our way of eating. Let's start before taking iftar. We have to take fluids in excess because of the long day of fluids. And then we have to take just a short time in order to decrease acidity of the stomach. Then we have to take our meals. Our meals must be controlled, and must be, the way of eating itself must be changeable. For example, as for meat, we have to take grilled meat or boiled meat, and to decrease amount of grilled meat, we have to take the amount of smoking. Also, what about rice and macaroni? Can be, this pasta can be decreased in its amount. As for salad, we have to increase the amount of salad, and so on. So the amount of eating we have to control. We have to take dates. Dates are very important because dates contain a famous amino acid, which is tryptophan. This tryptophan can pass through the brain and stimulate the brain in order to secrete a substance known as serotonin. Serotonin decreases amount of pain for the fasting person from one point, and in the meantime it contains magnesium, which leads to increase the amount of alkalinity of blood, and so leads the fasting person to be quiet, and so on.
That's why a lot of people start out with a date.
Yes, of course. And so on. So you have to control the amount you have taken. You have to take fluid amount at first, and then you have to take bulky amounts later on. There must be a time between taking fluid amount and taking a bulky amount of food. Then you have the way of sport itself. You have to walk after eating. You have to walk. Of course, it's better to go for walking. And as for sporting, we have to divide sports into 3 main types. Sporting just after eating is very important in the iftar. And the sporting in the early morning is very important because it makes the body is fresh, and also leads destruction of fats, is a main source of energy, and also in the meantime it prevents precipitation of fats in the muscles and skeletal muscles. But sporting before iftar is very serious because the fluid of fasting blood sugar in blood is low, at its lowest blood. And I have read in the British journal, medical journal, that there are many cases have died because of severe sports before just iftar. So it is important for sports. At first, it is better to be after iftar. It is better to be early in the morning. It is not preferable to be just before iftar.
Yes, Dr. William, of course, like I said at the beginning in the intro, I said that there are some chronic disease and some people with diet and people who have skin disease. You said we were talking off air, and you said that in particular fasting could be a good remedy for some of those chronic disease and some of those skin disease, and even psychologically also it could be a good remedy. So could you explain to us more about the benefits of fasting to the most popular chronic disease that could be a good treat for someone, for example, with diabetes or hypothyroidism or other disease like that?
Oh yes, there are many skin diseases which can be affected by fasting. For example, acne vulgaris. You see, acne is the main disease. It is under the control of diet and under control of drugs. Once you are fasting, amounts of fatty diet which are entering before, causing acne decreases, and so acne can be treated just by fasting and just by decreasing amount of these drugs taken. Also another drug, another disease such as vitiligo. Vitiligo is one of the diseases in which there is hypopigmentation of the skin, and it is related to psychological and case of the person, and also related to the immune system of the person. By fasting, this psychological case of the patient is increasing, and also the immune system is increasing. And so one of these diseases, such as vitiligo, can be treated but just by fasting. Also hair fall. There is an element relating to psychological element, and by fasting the patient becomes quiet and calm, and this element can be treated. Also there are many other diseases, such for example peptic ulcer. One of the diseases is peptic ulcer. Once fasting, this peptic ulcer can be treated if it is mild type and so on. So there are many types of diseases can be treated by fasting. Also regime. Any person trying to decrease his body weight can by fasting control his diet and decrease his body weight and stop obesity. Also smokers, also just by fasting, stopping smoking can be controlled, and the person can stop even smoking just by fasting. So there are many other diseases, which can be treated by fasting. On the other way, there are many diseases which fasting is stopped or prevented for them. For example, a disease called lupus, systemic lupus erythematosus. In this disease, fasting is contraindicated because the patient is present inside intensive care and he needs lots of drugs and so on. Another disease such as pemphigus, in which there are vesicles which are maybe epidermal or subepidermal or subdermal or even mixed. This disease, which is pemphigus, fasting is contraindicated because this patient in need of excessive fluids and excessive treatment and excessive drugs, and so it is contraindicated for him to be fasting. So there are many diseases which can be take fasting and can be treated. Another group of diseases, fasting is contraindicated for them because there are many problems fasting them due to fasting.
Of course, we're talking about iftar. What about suhoor? Suhoor is usually known as what we eat very late at night, right before dawn. What's healthy to eat? What's not good to eat? Especially because usually people eat and go to bed. And it's not very healthy and beneficial to eat and go to bed. But a lot of people do this because they think that the next morning they're not going to be hungry. So is this healthy, and is it true? And what should we eat during suhoor?
And usually the opposite happens.
Right. Usually the opposite happens. When we eat, we get more hungry.
The first advice is excessive fluids. The person must take excess fluids between iftar and suhoor. And then some milky products such as yogurts, such as milk, are very important. Also dates are very important in this period. Also we can give small amounts of bread. We have to decrease everything related to salts, because salts are very serious during the day and bring the person to be feeling thirst. So we have to take everything away from salts. And excess fluids are very important, excess yogurts are very important, and so on. Yes.
Well, salts could be also important to people with low blood pressure. So if I'm fasting and I'm not taking any, there is no input of any food, and lacking also the source of salt, would that be harmless?
Salts are very important during iftar, and just before suhoor, it's better to decrease amount of salts. But at midnight, can we take any type of salt? Of course. But just before suhoor, it may be very serious during that at the end of the next day. Also, we have to put in mind the excess amount of fruits. Fruits are very important for this person in order to fast and take fasting for a long time. All types of fruits are very important for the person, except something such as grapes, such as bananas, such as mango, which are maybe of problems to the fasting person.
Banana?
But all types, yes.
I thought they were safe. Bananas?
But at the end of the day, make the person to become thirst and in need for excess
Okay.
water. So
And it's really
it's
hot.
better to
Hot.
decrease amount. It's better to be taken after iftar, but it's not better to be taken before suhoor. Yes.
How about sweets? I mean, Ramadan is very well known for a lot of
Big
sweets,
time.
and they're very good. Especially some of them aren't really made. They're only made during Ramadan, like atayif and kunefa and the baklava and all that stuff. And so, how can we track what we eat?
Very hard to resist.
And they're very hard to resist. So, when can we eat the sweets, and when should we avoid them?
Here lies the problem.
And in what
The
quantity?
problem of sweets.
Mhm.
It's better to eat sweets at the period of iftar until the midnight. It's not better to take all these sweets before suhoor, of course, because they make the person thirst for a long time. And the second advice is to take these sweets and maybe followed by walking. Don't eat sweets and stay inside home, inside house. You have to go to Taraweeh, to walk, and so on. Don't be laying inside, because all these sweets maybe go to the other side and makes fatty persons and tries to be a first line of obesity and so on. So you have to take sweets at iftar till the midnight, and don't take sweets before suhoor, because these sweets will be later on make you feel thirst in these hot days.
Yeah, but Dr. William, when we mention sweets, it's very important to make that note, because when you eat sweets and you eat how much can a stomach take? You can take the iftar and then the dessert, which is the sweets, and then and fruits and the juice and ice cream or whatever people can take after a long day of fasting. But then you become bulky and you can't move.
That's true.
Yes.
So
Here,
there must be some mechanism or a formula that would work with the excessive amount of food, that feast that
Yes.
Egyptians sat on the table
yes.
every day on
And
Ramadan.
you usually invite family over and being together. You eat a lot. And
Here lies two problems. You have spoken about 2 points. The first point, we have to take our meal in multiple small snips, never to be bulky. The second point, once you eat bulky amount of food and you are suffering from cardiac problem, we know that during eating of this bulk of food, blood is shifted towards the stomach and become less away from the heart. So persons who are suffering from cardiac problems might suffer from cardiac catastrophe due to this full stomach. So it's better, the golden advice for anyone fasting during Ramadan is that between iftar and between suhoor, you have to take multiple small snips of food, never to take a bulky food once. It's better to divide your food for many bulky amount of meals, maybe 5 or 6 or 7, and it's better than one huge bulk stomach, which may lead to cardiac problem and so on.
we don't eat everything at once.
It's better.
So if we wanted to give some advice to smokers, I mean, during Ramadan you can't really smoke, and I mean, what's the danger in, I mean, after they eat, do they tend to smoke a lot, and what are the dangers of that, and how can we guide that section of the population?
It's the
I mean,
first-
smoking is danger in itself, and we're trying
Yes.
to avoid it in general, but for those who already smoke, how can we guide their usage with cigarettes?
You think that once the person is fasting all the day, the stomach, there is hyperacidity. So there are some persons who are smokers and start to become iftar by smoking. Here, hyperacidity plus smoking may lead to peptic ulcer, and later on may lead to carcinoma of the stomach, which is very serious. So our advice for these persons is to take this Ramadan in order to stop smoking. It's better for them. But if they are still smoking, it's better to take smoking after they take their meals and not before they take their meals, because of the serious problems of making peptic ulcers or change of the gastric acidity, which is very serious for the body. So it's better to stop smoking. Many of my friends stop smoking during the holy months of Ramadan.
It's a good opportunity for them to
Yes.
cut down.
It's better to cut down, absolutely, from now.
But also people who are on diet, on the usual diet. So the usual diet that we undergo during the whole year, is it suitable and fit for the holy month when we are fasting and we break our fasting on the same food that is registered on the menu of our diet, or should we go through a different diet for Ramadan? I mean, is the diet fit for any month and any routine?
There is nothing called usual diet. There must be diet, and diet is changeable from person to person and from the person himself.
I mean, there is food that could give us energy while we're fasting.
This food depends on our work, our movement during the day. So once you take food, you have to take amount of food which is suitable for your work. You have to take food related to your weight. But during Ramadan, of course, we can use certain type of regimes and food in order to decrease our body weight. Of course, there are certain types of food and certain types of regime which are suitable for this holy month.
Is it healthy to undergo a diet in Ramadan? I mean,
it is very healthy. It is very healthy to do. It is very healthy. You can eat everything, but related to your amount and related to your work, and you can lose your body weight. It is very healthy. Yes, my golden advice for any person fasting Ramadan is to take his suitable diet, which is suitable for his body weight and for his job, in order to decrease his body weight during this holy month of Ramadan. Yes. Yes.
Right, you've mentioned the menu. You were just talking about including the food that we eat in Ramadan, what to eat and what not to eat, the do's and don'ts. But there is also the menu of Ramadan, the very popular Arab or Egyptian menu, or the good old menu of Ramadan, which includes the dates, which includes the dried fruits, which includes many things that even the West do not really appreciate the real value of it, and the fact that it might cure us from disease, and it might make us lose weight, and the many benefits that are accompanied with this menu. So could you count down, or could you set up some of these ingredients in that menu, like the fruits and the stuff like that?
During Ramadan, the main menu includes beans. You see, beans is very important for during
the
iftar.
Beans.
Yes. It's better for us to take beans to remove its cover, because the cover of beans contains tannic acid, which prevents absorption of iron, which is present inside the beans. So you have to remove the cover, which is present inside meals, in order to enable the body to take the iron which is present inside meals. This is the first advice. Second advice related to dates. Of course, dates contain famous amino acid, which is tryptophan. Tryptophan passes through the blood-brain barrier and stimulates the brain in order to be able to secrete serotonin. And this serotonin is very important because it helps the body to withstand pain during the day and to become more calm and more quiet. This is the second thing. Third thing related to the fruits to be taken, it's our advice to take excess amounts of fruits, because fruits are very suitable to give us sucrose, which is fructose. This fructose is enable us to withstand fasting, and it is important for our movement during the day. So there are many advices related to our meal, and as I said in the early, that as for meat, it must be not grilled, it must not be fried, it must be grilled or boiled, of course. Also, we have to take our bread, it must be a decreased amount of bread during our meals. As for rice and pasta, amount must be related to the body weight and in divided doses, and so on. As for components of milk, such as yogurt and milk and so on, we have to take excess amounts from this related to our body weight also and related to our work, and so on. We can control our diet, and we can decrease our body weight, and we can take everything from those of Ramadan. This is the golden advice for anyone looking for us, that he can take this holy month of Ramadan in order to make a regime to decrease his body weight and to take his all types of sports in order to be in good health and in good appetite.
Right.
Resist the delicious food.
Right, Dr. Munir William, Professor of Plastic Surgery and Nutrition Consultant. I'd like to thank you very much for your valuable tips. Thanks for coming.
Thank you.
Thank you. And with this, we're going to go to a really short break with our reporter, Dina Yunus, who's going to show us one of the most beautiful places here in Egypt, which is Luxor. It's a city in Upper Egypt known for its amazing monuments and artifacts. And Dina Yunus is actually going to take us to one of the Luxor Bazaar is there to show us the products and everything sold at the place. We'll be right back.